All right. So Politico published a story not too long ago, about 5 days ago. Published a story called "It's Like Every Red Flag, Trump Ordered HHS Ad Blitz Raises Alarms." Now, in of itself, an advertising campaign to get out the word about COVID-19 would actually be a pretty good idea, right? In fact, getting celebrities on board, that would also be a pretty good idea. You want people who kind of vibe with people on both sides of the aisle, But one of the issues here with this particular plan is the fact that, I have no problems with who they tapped, which include, Dennis Quaid, who's kind of a quackadoodle, but you know what? We'll gloss over that. It's the fact that they spent $300 million on it, which is a large amount of money. Even when in our government the words billions and trillions get thrown around a lot, 300 million is still an awful lot of money. The issue here being that they took that money from the CDC in the middle of a pandemic. So basically, the Ad Blitz has been described in some budgets as the COVID-19 immediate surge public advertising and awareness campaign, which is great, but it's also coming after we've all been living under quarantine conditions for 8 months, 7 months, 8 months now, a very significant period of time. Yeah, so they're leaning heavily on celebrities and pillars of the administration, I guess, to kind of get the word out. Again, not a problem in and of itself. The fact that it's coming so late, the fact that it is coming right before the election, it's expected to start airing literally a week before the election, seems to be a very transparent attempt by the Trump administration to make people feel like he has been doing something, when in fact, he's been doing exactly jack and shit. So, it seems like this is a highly agenda-driven campaign, and not only that, all that money comes out of the CDC. So, they're taking all of this money that could be going to providing people with masks or providing hospitals with the equipment they need and spending it on what amounts to a vanity campaign for the Trump administration and an attempt to rehabilitate their colossal failure that has led to over 200,000 people dying. It's really quite astonishing. It's incredible. I do not know how to really emphasize this any more clearly than I already have. They are using the deaths of hundreds of thousands of people as a political tool in order to make it seem like those deaths were inevitable. As if we didn't know that COVID-19 was killing people, as if they weren't 4 months ago extolling the virtues of consigning our elderly and vulnerable populations to death in order to keep the economy running. And now they're going to be like, oh yes, we've gotten Garth Brooks to come on and talk about how COVID is real and how you can protect yourself. And it's the president could just do that for free, but we're spending $300 million on it, which is really, really irritating and really troubling. And again, this is just one small thing. It came out 5 days ago. almost everyone has already forgotten about it. Almost everyone. Like, you're not gonna see it in the news. It's gonna, like every single day, overwhelming stories of this magnitude keep popping up about Trump and his administration, and like different types of like corruption or fraud or misuse of resources. And this is just another one that's gonna like just in this administration. It's just another day. But I feel like we need to highlight this in particular because we're still in a pandemic, and they're still estimating that another 200,000 people could die by by the end of the year. Like that's crazy. That's super crazy when you have countries on like with far less resources and far fewer experts at their disposal, and they've been able to keep deaths below 1,000. Like, we've just so utterly been screwed over that it's really hard to make people understand the depths and severity of this. It's upsetting, like on a personal level. Like, I I want people to be happy and healthy. I want people to be able to go to the hospital if they're sick. I want children to be able to receive treatment. Like, that's an overlooked aspect of this whole conversation about healthcare. Did you know that there are over 3 million children who just don't have health insurance coverage of any kind in the United States? I didn't know that until I started working with the nonprofit I work with. Did you know that there are an additional 39 million, children on Medicaid who don't get full coverage for their various ailments and problems? Like, we have over 40 million kids in the United States who, to some degree or another, aren't going to get the treatment they need because they happen to be born into poor families. And we're in the middle of a pandemic, which means disproportionately people on that lower income side of things are going to be affected by this pandemic because they are forced to go to work by these people in this administration who have been pushing the line that this is all fake or overblown or not a threat or not a problem, and in order to keep stock prices up. And from there, they are then further defunding the one organization that has been trying its best to inform people and keep hospitals equipped, and they are defunding it by $300 million in order to run ads to tell people that it's real after we've been locked in our homes for 7 to 8 months. It's infuriating on so many levels. And you know what? So much of this could be solved with Medicare for all, universal healthcare coverage. And that's why it's a little bit grating. And I don't want to harp on this too much because we all need to ride with Biden on November 3rd. But it's really disheartening to me that the Democratic platform can't embrace Medicare for all and just be like, yeah, it's a universal program. It's socialism, and it happens to be good. What, you don't want 40 million kids to be covered by health insurance? Like that, it should be the easiest thing in the world to defend. But we all know why it's not. And that's because of insurance companies and lobbyists and all kinds of special interests that are invested in squeezing the most amount of money they can out of sick and dying people or injured people. And yeah, that needs to change. And it's not going to change during this election, but going forward, every election after this one, we need to make that a priority. So that was my little little spiel for for why this particular story about the CDC being robbed of $300 million to run an ad campaign with celebrities really cheeses me off. Especially when it's mostly being done as a political stunt to fluff the ego of a fascist. So that's what I'm talking about here. Bloop. End of segment. How y'all doing? Ashley, let's check in with you here. Let's see how you're doing. Chat. The biggest issue of this is the fact that the money earmarked to the CDC is being misappropriated by Trump again. Exactly. Yeah, I mean, exactly what it is. Yeah, preach. I like eating a lunch on the subway. Good for you, Willy Dilly Wonkadonk. I appreciate you. Whatever your opinion is, I agree. Okay, I'll take it. Write to your politicians about wanting universal care. I agree. You should do that. I doubt that they will read it or that it will make a significant difference, but on the off chance that it does, I'm not going to douse anybody's enthusiasm for contacting their elected representatives. Archangel DeKalb, it sucks more because, like, every developed nation has some form of universal health care. True. And in fact, the United States does have that. It's just for our senior citizens. And really, it should be for more of its citizens. Free socks for all. Honestly, not a bad idea. People should have access to basic clothing. Flood them with letters. Vote me into office. So far, Willy Dilly, liking sandwiches on the subway and free socks for all. Not bad plans as a platform, especially when we have incredible numbers of homeless people who desperately need socks. Yeah, email works. I think the most effective thing you can do if you're bent on contacting your senators, rather than writing an email or a letter, consider giving them a phone call. Because that demands someone pick up and answer you.